Imagine this. You wake up, your dog usually greets you with boundless energy. But today, they're stiff, slow to move, maybe even whimpering a little. Hi, I'm Lyndall from Vetster, and today we're talking about why your dog might be stiff and having trouble walking, and most importantly, what to do next. We're going to cover the big issues of stiffness, like arthritis, seizures, injuries, toxins, and what to do in each case. As usual, all of the information in this video has been carefully reviewed by leading Vetster veterinarians. So let's dive in.
Dogs can get stiff or have trouble walking for a lot of different reasons. Some are minor and pass quickly, some point to long-term conditions, and others signal an emergency. Knowing how to tell the difference and when it's time to reach out to your vet can make a big impact on your dog's health and comfort. Let's start with one of the most common culprits, especially in our senior dogs, arthritis. Arthritis, or osteoarthritis, happens when the protective cartilage inside your dog's joints gradually wears away. This leads to bone-on-bone friction, inflammation, and a whole lot of pain. It typically comes on slowly. You might start noticing your dog having trouble getting up after resting, stiffness in their legs, or a reluctance to jump onto the couch, go for walks, or climb stairs. While it gets worse over time, arthritis is generally not an emergency, but it absolutely requires veterinary attention for pain management and improved quality of life. On the other hand, some causes of sudden stiffness and mobility problems are definite emergencies. We're talking about things like seizures and toxin exposure. During a seizure, a dog's body can suddenly go stiff, often followed by tremors or uncontrollable movements. This can be terrifying to witness, and it's a medical emergency. Similarly, toxin exposure can cause acute stiffness and neurological issues. Along with sudden mobility problems, you might see severe vomiting, diarrhea, excessive drooling, or even collapse. If you suspect your dog has ingested something toxic, time is critical. Sometimes a dog freezing up is simply a normal reaction to stress or fear. This usually passes quickly once they feel safe. And after intense activity, even a healthy, active dog might show a little stiffness when first getting up. This post-exercise stiffness should ease up once they start moving around. These instances are usually not causes for alarm. Now let's circle back to other common joint issues beyond just general arthritis. We often see conditions like hip or elbow dysplasia, which are abnormal formations of the joints. Or perhaps a torn ligament, like an ACL tear, or even dislocated kneecaps. These conditions cause similar stiffness and pain to arthritis, but are often seen in younger, more active dogs or specific large breeds. These aren't always emergencies, but they definitely need a vet's diagnosis and treatment plan. Of course, sometimes stiffness is due to a more direct injury, like a sprain, a broken bone, or even something more serious like bone cancer. And then there's a rarer but very serious condition, tetanus. This can develop if a wound gets contaminated with specific bacteria found in soil. Over a few days, a dog's entire body can become severely stiff, even affecting the muscles in their ears, causing them to stand rigidly. Tetanus is a serious condition that requires immediate emergency care. Let's delve a bit deeper into seizures. They can manifest in different ways. A generalized seizure affects the whole body. Your dog might lose consciousness, become stiff, and shake uncontrollably. A focal seizure, however, affects just one part of the body, like a twitching limb or facial muscle. Some seizures don't even look like typical seizures. They might just cause odd, repetitive behaviors or periods of confusion. While most seizures are caused by epilepsy, which can have a genetic link, other serious causes include thyroid disease, kidney issues, brain tumors, head trauma, or infections like distemper or rabies. Poisoning is another urgent concern. Common household items like antifreeze, rat bait, some flea and tick products, or even certain human medications can be extremely toxic to dogs. Symptoms usually come on fast and are severe. Beyond stiffness and seizures, you might see excessive drooling, trouble breathing, or rapid collapse. And remember, some poisons don't even need to be swallowed. They can be absorbed through the skin. Always keep harmful substances securely locked away and out of paw's reach. No matter the underlying cause, stiffness and walking problems are rarely isolated symptoms. They're usually just one piece of a bigger puzzle. Dogs might also limp noticeably, tremble, lose their balance, or simply seem weak and lethargic. You might also observe changes in their behavior, like a sudden refusal to eat, acting aggressively due to pain, or even struggling to go to the bathroom. The specific combination of signs gives your vet crucial clues about what's going on inside. When you take your dog to the vet, they'll ask you a series of important questions. Did the symptoms start suddenly or gradually? Are they constant or do they come and go? Have you noticed any tremors, balance issues, or changes in their normal behavior? They'll also want to know about any possible toxin exposure, even if you're unsure. To get a diagnosis, your vet may recommend various tests. This could include blood work, urine tests, X-rays to check for bone or joint issues, ultrasounds, or even advanced imaging like MRIs or CT scans, especially for neurological concerns. A thorough neurologic exam might also be needed. But if your dog is currently having a seizure or you suspect poisoning, emergency care comes first. Testing may be secondary to immediate stabilization. Once there's a diagnosis, treatment is tailored to the specific cause. It might range from pain medication, anti-seizure medication, or antibiotics for infections, to surgery for injuries or severe dysplasia or specific treatments for toxin removal. For chronic conditions like arthritis, long-term care is usually needed. This can involve weight management, physical therapy, joint supplements, and daily aids like ramps or raised food bowls to make life easier and more comfortable for your dog. How serious the situation is depends heavily on how quickly you act and what's behind the symptoms. Some conditions can be managed effectively for a good quality of life. Others progress over time, requiring ongoing adjustments to care. And some, particularly acute poisoning or severe injuries, can become life-threatening very quickly if not addressed immediately. So, when is stiffness an emergency? If your dog suddenly goes stiff and can't walk, collapses, seems disoriented, or has a seizure for the first time, get help right away. The same goes for any sudden trouble breathing, uncontrollable vomiting, or diarrhea, or if you suspect they've been poisoned. When in doubt, always err on the side of caution and contact your emergency vet. But if the stiffness comes on slowly, like with typical arthritis, it's usually not urgent. Still, it's a good idea to get your dog checked out promptly to start managing their pain and improving their mobility. Let your vet know if your dog's been showing gradual signs like joint pain, stiffness when getting up, or a general reluctance to move or play. If your dog is showing any of these signs, don't wait too long to act. Early care can make a big difference in their comfort, health, and happiness. Still have questions? Check out the related videos linked below, or connect with a licensed veterinarian online and get answers in minutes. Thanks for watching. See you in the next video.